Hello, and welcome to OutRight TV, a video and podcast series bringing you stories of LGBTQ people and allies across the globe as we face this pandemic together. I'm Sahar Mazami, UN Program Officer at OutRight, and for today's episode, I am talking to Suba Vijayasirivardhana in Sri Lanka. Suba, welcome to OutRight TV.
Hi, and thanks so much for having me.
Yeah, we're happy to have you. So Suba, I met you through OutRight about a year and a half ago and quickly came to learn about the amazing activism you were engaged in. Can you tell listeners a bit more about yourself?
Sure. So I'm Suba. I'm based in Colombo, and that's in Sri Lanka. And I can just say a little bit more about the work that I've been involved in. So I have been working on LGBTIQ rights and on women's rights and sort of on gender and sexuality for a few years. I've been, involved and connected with the feminist movements here and the women's movement here for about 3 or 4 years in the capacity as an activist and as a researcher. And I now work with an organization named CREA, and we're a global feminist human rights organization led from the Global South.
Amazing. So just to switch gears a little bit, what does life look like in Sri Lanka right now, and particularly Colombo, in light of COVID-19?
Yeah, I'll just sort of back it up a little bit to give you a little bit of history in terms of how we entered the fray, so to speak, with the coronavirus. I think, Sri Lanka was alerted to it fairly early on in terms of, in relation to lots of other places, particularly the West, I think. Sri Lanka has sort of many political ties and trade ties with China. And we also, I believe, are sort of heavily promoted as a tourist destination in China, apparently. So we have a huge number of Chinese tourists that travel to Sri Lanka every year, actually. And so because of that, I think we were kind of alerted to the kind of potential threat and what was happening in China quite early on, as early as late December. And I believe in about mid-January, we had our first case here on the ground, which I believe was a Chinese tourist who she tested positive for coronavirus while visiting in Sri Lanka here. And I mean, it was fine. She, was treated and she recovered, and then she returned to China. But I think by that time, therefore, already, by end January, certainly, we were already in the know about what was happening, what had been happening in China and the rest of East Asia. And we were certainly in the know about the risk of it spreading. And we kind of officially went on, an island-wide, what we call a curfew around early March, which I think is around the same time as similar, measures were taken in many other countries. And it means that basically we can't go outside. So it just means that everyone has to stay indoors. And I think the curfew is basically being enforced by the police at the moment. And I mean, we have a very strong public health system, which is good. And I think we, have managed to kind of keep the sort of numbers and the, infection, the spread to somewhat a degree quite controlled. I think we've had around like 150 or so cases in total. And I think we have like a 16% recovery rate or something like that. But we have had 4 deaths, and the last one was quite recent, like literally a few days ago. So, I mean, I think, that the anxiety and the worry and the fear is certainly there, and it's certainly palpable. But there's a lot to be thankful for in Sri Lanka here, and I really think that the chief of those is our healthcare system.
No, of course. That matters so much in situations like this, right?
Absolutely.
And you made actually a really interesting point. You said, so you guys actually had your first case in January, although it was a tourist who recovered. But then from January up until March, was there any, so what was, I guess I'm curious, what was the conversation like? Or was there any, how was the anxiety building in that time? Because of course that is a bit, right now it seems like that could feel like years actually. but
Absolutely.
it's actually a relatively short period of time. So what was that like until everything kind of happened?
Absolutely, yeah. I mean, it certainly feels like a lifetime ago now that we had that one tourist, and we all kind of watched from the sidelines. She was very kindly and carefully treated by the healthcare system, and then she made this recovery and she was sent, she returned to China. Um, I mean, it's interesting to think that, we knew fairly early on, and I think we knew the risks fairly early on, but there weren't many state level measures taken. I mean, there wasn't really a state level response at that time. Certainly, there was a lot of anxiety among just people, among the public.
Mm.
Um, and there was already a lot of information being shared, and a lot of, and with information, a lot of misinformation, or a lot of just fake stuff being shared as well. But there certainly wasn't a strong state level response until much later. And I mean, in hindsight, maybe that's a little unfortunate, especially because, when the curfew was declared, it came to us very suddenly.
Mm.
And people really didn't have a chance to prepare for going under curfew for an indefinite period of time. Now in Colombo, in the Colombo district, for example, we're under curfew indefinitely. Like, we don't know when it will be lifted, which makes things really difficult, because you just, you can't really gather a certain amount of goods or provisions or anything, because you just don't know for how long.
Mm.
In some other districts, they are taking things a little bit differently, because it's not as much, I think there is not as much a risk of the spread. I think Colombo, the district, has definitely been identified as a kind of a hotspot. But I think what would have been good is for the government to have given people a chance to prepare, or to have eased people into a full-on curfew.
Mm-hmm.
It would have been kind of better, and also more effective, I think, if there had been a kind of a gradual increase in terms of these measures, where people had a chance to sort of gradually prepare themselves and then go into a more kind of full lockdown situation as the need arose in March. So I think that may have been a missed opportunity in some sense.
Mm-hmm. Mm-hmm. Yeah, I can understand that. Can you, so you started to speak a little bit about it, but can you, like, how has this impacted you? What's the hardest part about the situation, and for you, for your community, things like that?
Yeah, I mean, really don't want to talk about myself because I actually am very lucky. I belong in a very sort of privileged minority. I mean, for all intents and purposes, I'm fine, I'm well, I'm safe, and I have access to sufficient goods and provisions to keep me going for at least, the next week or whatever. I also live, in the city, where even in the worst case scenario such as this, we have some access to online delivery systems and things like that. But I do want to sort of flag that this is not the reality for many, many people, particularly for daily wage earners and other low income groups. And that's both urban and rural. A lot of people who migrated into the city and live and work here and are kind of stuck indoors now are really, really suffering and are taking the hardest hit. Obviously, this includes, many LGBTIQ people, particularly poor trans people, sex workers, and people who are, not able to live with their natal families, like some of us, have the comfort or whatever being at home and have other people around you and take care of you. Many, particularly low-income folks in the queer community don't live with their families. Have also experienced family violence, etc. So live in kind of community housing with lots of other people, sometimes in very small spaces. So that's, these are all these are all perspectives that kind of get left out when we talk about things like social distancing or self-isolation. Like, that just is not a reality for many people.
Mm-hmm.
And that is just not something that is possible, nor is it something that is kind of a part of a discourse for many, many people, right?
Yep.
And I really think that the suddenness of the curfew really caught us off guard, and it's really unfortunate. But you know, in a sense, the ideal situation would be that you can put a public under a curfew, but you need to have certain systems in place to ensure that people who don't have access to money, or don't have the ability to access online systems, don't have bank accounts, don't have credit cards, and so on, that they are going to be okay, and that they are going to have access to basic necessities.
Yeah.
Like, there are people who don't have food right now. There are people who don't have sanitary pads, who don't have a way to, kind of take basic hygiene measures when you're on your period. So, I mean, I think this is the real crisis. And again, I want to say that if you kind of look at the South Asian region, certainly we in Sri Lanka are very lucky for many reasons. Like I said, our healthcare system for one. And, there are, of course, many kind of informal initiatives that have been taken on by individuals at the community level, and of course by some private sector players. But there is a huge gap that needs to be filled, where there needs to be really systematic measures in place to just get stuff to people in this time, and to put money in people's hands who otherwise rely on daily wages. And I think that's been really tough for many people.
I guess touching on that a little bit more, in this time of social isolation, lots of creative ways of engaging with friends and loved ones and neighbors are popping up on social media and geographically. Do you have a favorite activity for staying connected while being isolated?
Yeah, I mean, I don't know, but I read something that Zoom stocks were up. I mean, I think we're certainly all, migrating towards various online and internet-based tools to help us keep in touch and to help us speak to our family and friends. I think this is also just another interesting, a point that I would like to make is that I think this is really a place where I think the rest of us have a lot to learn from the disability rights movement and people with disabilities who have been telling us since God knows when that this stuff is actually just about habit formation, and that it's not really like a crazy paradigm shift. So I think many of us, non-disabled folks are now having to, proactively familiarize ourselves with these systems that actually help and kind of help connect and help collectivize and help us stay in touch. A favorite activity, I mean, to stay in touch, obviously, I have tried to kind of have some intentional time every week to speak to my family and friends, and of course my coworkers. And in a way, I think it's kind of interesting that I think our interactions are a lot more deliberate and a lot more qualitative right now, because I think we're all sort of living in this reality that seems very frightening, and that is, really, I think, bringing a new appreciation to having the opportunity to chat with people that, that are in your community. So I think in that way, I think it has been an interesting kind of shift, where I think there is certainly a lot more, intentionality in the way that we're staying in touch.
Absolutely. And I think that's really key, right? Like the gratitude for that
Absolutely.
aspect of it. Well, Suba, thank you for taking the time to speak with me today for OutRight TV, a podcast and a video series which brings to light stories of LGBTIQ people and allies across the globe as we face this pandemic together. This was Sahar, UN oh, sorry, please.
Sorry, go on.
So thank you so much for taking the time. And with that, this was Sahar, UN Program Officer at OutRight, and I spoke to Suba Vijay Siddivardhana. My colleagues and I will be back soon with more stories. Thanks, Suba.